Right on cue. I think we're ready to go. Well, hello, everyone. Good morning, good afternoon, and good evening. I know we're all over the world, so very excited to have you all join us today. Please continue to introduce yourselves in the chat. Would love to see where everyone's coming from and where they're joining us from. And welcome to Engage, our 2023 year in review. It's our annual event that we started last year to really highlight and summarize everything we've done, recognize our award winners, and all of our participants, and of course hear from wonderful speakers that'll be joining us today. So we'll go over a little bit about our institutes that just happened, as well as our chapters, our design competitions, virtual programs, more aspects of things we've been working on. And we will have a keynote speech towards the end with our EWH alumna, Deanna Hood, who I'm very excited to have with us today. We'll also have a student speaker, and then I have a very special announcement at the end. So please stay tuned to hear about it. And with that, I don't know actually if I officially introduced myself, but sorry, but I am Tujan Rahal. I am the president and CEO of Engineering World Health. But with that, I want to pass the mic over to our project manager for EWH Institutes, Susan Hyman, and very excited to have her share what we did this summer.
Hi, everyone. I am really glad you're all here. I'll echo what Tujan said. Thank you so much for joining us and for being here to hear a little bit about what we have done this past year. My name is Susan. I'm the Institute's project manager at Engineering World Health, and I manage our in-person service abroad programs, which I will share more with you about now. So our summer institutes provide intensive hands-on training to university students and young professionals in STEM fields. They are between 3 and 9 week programs, depending on the program structure we have. Students receive this training and they learn about biomedical instrumentation and how to repair medical equipment in low resource settings specifically. And then after they receive that training, they're placed into hospitals in their program countries where they complete a volunteer placement. So they'll repair equipment, they'll do preventive maintenance, perhaps translate manuals, they'll complete a secondary project. At the end, our institutes conclude with a final conference where students share about their accomplishments. So I'm sure many of you are familiar with our institute programs, but I hope that gives you a brief overview of what we offer in terms of our international programs there. So this year in 2023, we had an excellent institutes year. We traveled to Guatemala, Uganda, and Nepal. We went to Guatemala twice. We had a winter program in Guatemala with Rochester Institute of Technology. And then we had an open enrollment 9-week program in the summer. We also had our open enrollment 9-week program in Uganda, and then we had a 6-week program in Nepal. So that was also in partnership with Denmark Institute for Technology. They do their training course on campus in Denmark, and then the students travel to Nepal with us for 6 weeks to complete their hospital placement. So that is a summary of where we were this year, and I'm excited to share at the end where we'll go next year as well. So this year in the summer, we worked with 39 volunteers. That includes 12 local students. And by local students, I mean students who are from and live in our program countries. So we had 39 students this summer, and they are from 11 different countries, including India, Denmark, Mexico, the United States. We had a really great, diverse group this year. So as I mentioned, included in those 39 students, we were able to work with 12 local students. So again, students who are from our program countries. And we're able to do this thanks to the Lynn Toby Fisher Scholarship Fund, which was created in honor of our late board member, Lynn Toby Fisher. So thanks to the support of her friends and family, we are able to incorporate these students into our programs, which is a really, really valuable part of the program and also a critical part of the EWH mission. So we're very grateful for that support. A little bit more detail about the accomplishments that all of our students made this summer. They completed a total of 395 repairs across their 3 countries and all of the different hospitals that they worked in. And we estimate this to be a value of close to $800,000 in terms of the repairs made and the hours worked. So that is pretty impressive, and we're really proud of all of the hard work that they shared with us this summer. There are also a couple more specifics on this slide. You can see the different kinds of equipment that were repaired by our students this summer. Some of them really frequently found, others a little bit more unique. So again, this is really exciting stuff. We're very proud of what our students were able to accomplish, and you'll be able to read more about this in detail in our program reports, which are going to be published next month. Lastly, I'm really excited to share some of our student feedback. One of the questions that we asked students in their program feedback form is if they could describe the EWH Institute experience in one word, what would they say? And these were some of the words that they came up with. So this is awesome, and I'm really excited to share this. I think our students had an excellent experience this summer, a really valuable experience, and we're looking forward to continuing to provide that. Now, I am especially excited to introduce a student who I had the pleasure of meeting in person in Guatemala this summer. I am pleased to introduce Virginie Ruest. She is an international student from Quebec City, Canada, pursuing a degree in biomedical engineering and a minor in neuroscience at the University of North Carolina at Chapel Hill. Through her experience in the Applied Biomechanics Lab at UNC, she discovered an interest in exploring the intersection of sport and biomechanics. Her will to make the world a better place drove her to participate in the Guatemala Summer Institute this year. So without further ado, I will hand it over to Virginie, who's going to tell you a little bit about how her summer was.
Thank you, Susan. Good afternoon, everyone. I'm super honored and excited to share a little bit about my experience as a Summer Institute participant. So as Susan said, I'm a third-year biomedical engineering student at the University of North Carolina in Chapel Hill. So we can maybe start the slideshow. Okay, perfect. Thank you so much. So I just want to start by saying that I absolutely loved my summer with Engineering World Health. I would go back to Guatemala tomorrow if I had the chance, but of course it wouldn't have been the same without the 15 other participants that I shared the experience with. So we had the chance to all stay together for the first month in Sheila. So we all stayed at the same hotel, which allowed us to get to know each other and build friendships by playing card games every night, by helping each other out with our Spanish homework, and by sharing typical Guatemalan meals morning and evening. And our group was also made up with 7 local and 9 international students from the US, Mexico, Denmark, Singapore, and Canada. So it was amazing to share about our different cultures and to learn from each other's different backgrounds and experiences. Next slide, please. Thank you. So we spent most of our days doing Spanish lessons. So every morning we started our days with 3 hours of Spanish lessons, which we took in teams of 2. So I really liked the format of those classes because they allowed us to get a lot of practice time, which I really needed. And then after lunch break, Larry, our wonderful instructor, taught us about the use, maintenance, and function of many common medical devices through his travel anecdotes, as well as his experience on the ground, which was super invaluable. And then during our labs, which were often led by our coordinator, Laura, we practiced soldering and other hands-on skills by building tools that we would actually use at the hospital, like an extension cord or an ECG simulator. And we also got to work on some medical devices to get some more experience troubleshooting. And then on Thursdays, we got to go to the hospital Rodolfo Robles in Sheila. I think that's on the next slide. And over there, we got to interact with the hospital staff and also make some more repairs to get a taste of what the second month would be like in our hospital placements. Then when we weren't at the classroom or at the hospital, we like to spend our time hiking volcanoes, playing at the waves at El Paredons, or admiring Mayan ruins of Tikal, among many, many other activities that we enjoyed as a group. And then for the second part of the program, our group was separated into 4 smaller groups of 2 local and 2 international students. I was personally placed in Antigua, but Sheila, Rayu, and Solola were the 3 other hospital placements. And over there, we got to fully experience Guatemalan culture by staying with a host family. So for me, Carolina and Adolfo were super welcoming, and they spoiled us with delicious traditional food. They also welcomed other volunteers from all over the world. So I got to meet people from Spain, France, and Belgium. So that was also amazing. And it was extremely valuable to have the 2 local students with us at the hospital for the first 2 weeks of the second month. And that's on the next slide. Because we needed them to gain the trust of the hospital staff with their Spanish speaking skills. So we found that showing our faces and making rounds at the hospital regularly and introducing ourselves to the chief of each department on the first day helped us show how motivated and committed we were to making a difference at the hospital. And I think that one of the biggest impacts that we've had at the Hospital Nacional Pedro de Betancourt was with the fabrication of 10 skin temperature sensors. So when we arrived at the hospital, the neonatology department of the hospital only had 1 working sensor out of 11 infant warmers. That's on the next slide. Sorry. Yeah, so the doctors were not able to regulate the temperature of the babies because an alarm keeps beeping if the adapter of the sensor is not plugged in. So they could only use the infant warmers as beds, basically. So our group came up with the solution of modifying non-compatible sensors by adding a certain resistance that we found by doing multiple rounds of testing over a couple of weeks. And then to build the adapter part, we used pieces and wires from that we found in the equipment graveyard because we couldn't find any of the pieces we needed at the hardware stores in Antigua. So it was really, really fulfilling to see our sensors being used when we returned them and to receive words of gratitude from the hospital staff. And then another important part of the program is the completion of a secondary project, which can take many, many forms as long as it meets the hospital needs. So for my project, my partner, Sophia, and I came up with the idea of building a folic acid dispenser because when discussing with a trauma surgeon, we learned that there are 1 to 3 cases of folic acid, of clubfoot, per day at the hospital, and this can be prevented by taking 400 to 1,000 microgram of folic acid during the first trimester of pregnancy. So we came up with a solution of building that dispenser to provide a few capsules to each pregnant woman every time they visit the hospital for an appointment. Then we also made some informational posters that we placed around the maternity clinic of the hospital and made some documents for the doctors and the pregnant women to monitor their folic acid intake as well as the clubfoot occurrence after birth. And during the interviews that we conducted with the hospital staff when trying to find our secondary project, many doctors and nurses mentioned that they wish that more biomedical engineering technicians worked at the hospital because when a device doesn't function, it's often sent to maintenance, but none of the maintenance staff at our hospital really worked on repairing medical devices. They just sent the devices outside in the equipment graveyard where they're there for years before they're sent back to Guatemala City. Well, they could be easily fixed by biomedical engineering technicians. So I hope that with that, I convinced any potential participants to apply because there was really a great need of biomedical engineering technicians in the developing world. But I could continue talking about this for much longer, but I'll stop here and I'll be happy to answer any questions at the end. Thank you so much.
Awesome. Thank you so much, Virginie. There really is nothing like hearing it from someone who just experienced this themselves. So thank you so much for your thoughts and all of your wonderful photos. Next, I would like to give a really big shout out to our on the ground coordinators. So these people are our in-country staff. Of course, EWH is a small remote team, so these programs would not be possible by any stretch without our awesome on-the-ground staff. So big shout out to all of them. We just wanted to take a moment to highlight their hard work this summer as well. And finally, a big thank you, of course, to all of our student participants. We realize that this is a commitment. You know, you're spending 9 weeks in a new place, a new environment, and it's your summer too. So we're just so grateful that all of our students have taken the time to go through this process and to have this experience with us. Thank you so much. Lastly, a little sneak peek of what we have in store for summer 2024. Our applications are going to open on October 1st, so that is right around the corner. So if you're interested in applying, please keep an eye out on our social media, with our newsletter, on our website. We'll have all of that information ready to go on October 1st, and help us spread the word as well, because we really want to reach as many students as possible. And with that, I will hand it over to my colleague, Claire.
Well, thank you so much, Zan. Good morning, good afternoon, good evening to everybody. I'm Wild Health as the biomedical engineering and education consultant. I'm super delighted to be a part of this year's Engage Invest. Over the past 7 months, we've been able to host and run 3 virtual programs. The first one, EWH's second annual high school design competition, which is open to high school students around the world. With this, students are presented with challenges affecting low-resource health facilities. And thereafter, their task is to come up with a solution to one of these challenges. And then secondly, we facilitated a virtual global innovation workshop between the students of University of California, Berkeley, and University of Nairobi. This program enabled the exchange of knowledge among the students to tackle health-related challenges in low-resource regions through cross-cultural collaboration. I would like to extend my appreciation to partners from both UC Berkeley and University of Nairobi for making this possible. And equally, the MasterCard Foundation for supporting this virtual exchange. The third project that we facilitated was the Girls in Engineering PS program under the Empower Pillar project at UNSW Sydney in Australia. This project hosted 97 high school girls, and it exposed them to biomedical engineering through health-related challenges affecting low-resource areas. With that said, those are the 3 programs that we've been able to host this year. Next up, we'll be honoring this year's high school design competition winners. We were very impressed by this year's entries, which were judged by EWH, Summer Institute alumni, Khalud, Nuri, Al-Ali, and Justin Rose. Allow me to welcome our 3rd place winner, Andrea Panti, who submitted a design for reducing surgical infection rates by improving water distillation in the Dominican Republic. I'm happy to announce our 2nd place winners, Danica and Petra Chan, who submitted a recording of the acceptance speech for their project, The Solar Saver.
Hello everyone, I'm Petra and this is Danica.
We're currently year 12 students studying at Abbotsleigh in Sydney, Australia.
Our project centers around an emergency vehicle aimed at addressing the pressing oxygen shortage in Uganda's remote regions.
Through the integration of a mobile oxygen concentrator powered by solar panels, our goal is to offer a modest solution for providing much-needed oxygen supply to healthcare facilities, particularly in emergencies or areas with limited resources.
Thank you so much for having us in this competition. It's really unfortunate that we couldn't make the live event, but we really enjoyed this design process and learning more about it.
Lastly, we hope to incorporate the invaluable skills of critical thinking and creativity we learned into our future engineering projects. Thank you.
Thank you.
And finally, our 1st place winners, Rishi, Pranav, and Eric, Team Prime, who have equally submitted a recording of the acceptance speech for their project, the low-cost means for providing distilled water to healthcare facilities in remote areas of the Dominican Republic.
Hi everyone, my name is Pranav Gadaraju. I'm Rishi Madanori. And I'm Eric Stoll. We're 11th grade students from North Carolina, and we competed in challenge number 4, which was to design a low-cost solution for providing distilled water to healthcare facilities in the Dominican Republic. The first thing we did was research weather patterns and the process of water distillation.
Then we brainstormed different solutions and weighed their pros and cons to see which was most viable. In short terms, our final solution ended up being a rainwater collection system that uses solar thermal mirrors to concentrate sunlight and distilled the collected water.
This competition allowed us to gain a perspective on the challenges people face around the world and gave us an opportunity to problem solve to make the world a better place. We appreciate EWH organization for hosting this competition and introducing high school students like us to real world problems. Thank you.
Wow. Thank you, Rishi, Pranav, and Eric. Thank you all. Thank you again to all the high school design competition participants and judges for another successful year. And now I'm happy to pass the ball over to Janea Marville, our STEAM Education and Outreach Coordinator.
Hello, everyone. So as Claire said, I am Janea Marville. I am the newest EWH team member as the STEM Education and Outreach Coordinator. My background is primarily teaching, as well as some educational advocacy in the nonprofit world. So I'm really excited to be here and supporting the great work of this organization. So speaking of great work, I am elated to recognize this year's chapter of the year. Each year, EWH spotlights a chapter that has gone above and beyond in their efforts to support our mission. This year's recipients have embodied EWH's values and created a way to serve their local community. We are really excited to announce that this year's 2023 chapter of the year is Makerere University in Uganda. One particular activity that the Makerere chapter hosted stood out to us. They collaborated with the Makerere University Dental School Hospital to repair dental chairs and train students on how to maintain them. There's a little excerpt that I took from their chapter of the year report. So the goal of the outreach was to reduce the rate of medical equipment failure in Makerere University health facilities by repairing and maintaining them. A number of steps were taken to achieve this main goal, including establishing a bond between the student body and the university's health facilities, conducting a pilot study, compiling the pilot study report, raising funds, and conducting the outreach on the day of execution. The outreach exposed the students to a dental hospital environment, which was very unfamiliar to the majority of the students who attended the outreach. Students learned how to operate dental chairs as well as how to maintain them on a regular basis. So please allow me to introduce Juku George William, who will accept this award on behalf of the Makerere chapter.
Good morning, good afternoon, and good evening, everyone, whichever part of the country you are, or the part of the world you are in. Juko George William, and the former and the fifth president of EWH Makerere University chapter. And I'm so delighted to be accepting our award of the chapter of the year. It has been a good feeling, and I believe that all my colleagues from Makerere University are going to be delighted about this news. And Makerere, just to give you a background of Makerere University chapter, it started way back in 2014 by students, and they were guided by Dr. Robert Sechitoleko, who is our patron. And since then, we have been moving, conducting different activities, among which we have what we call the BME Hope, and the BME Hope is a collaboration with Makerere University Biomedical Engineering students. We move to different hospitals and we repair devices. We introduce engineering students to activities of biomedical engineers. They are mentored and they are shown basically what biomedical engineers have to do, their contribution in the world. We also have what we call the Embedded Systems Program. This is an activity that is organized by EWH MAC chapter. We also have what we call the Recess Gala. At Makerere University, engineering courses are different colleges, but in the Recess Gala, we get to come together as engineering students. We show each engineering student their role they have to play, no matter the discipline they are in. And we also have the indoor outreach, the one which they have just told you about, that made us to win the Chapter of the Year award. And here we go to Makerere University Health Facilities. Last year we went to the dental school. I won't repeat what has been said. but there are also other university health facilities like the Makerere University Hospital and other facilities at Makerere University. We go, we repair equipment, and yes, we are grateful to EWH for awarding us. Thank you so much. Thank you all.
Now I am happy to announce this year's third place winner, the University of Minnesota EWH chapter, for their project titled A Low-Cost Autoclave Temperature and Pressure Monitor.
Hello, EWH Engage. I'm Matthew Brown, one of the design competition team leads for the EWH University of Minnesota Twin Cities chapter. I'm sorry I can't be with you guys on the call in person today, but I wanted to film this quick video to congratulate my teammates and to accept this third place award. I want to start by thanking our faculty advisor, Professor Matthew Johnson at the University of Minnesota, and by congratulating my teammates, Austin Lange, Adam Levine, Aiden Decker, Nora Fritcher, Christy Allen, and Nicholas Stenland. Our project was a low-cost steam sterilizer, or autoclave, parameter tester, measuring temperature and pressure. We were inspired by literature about hospitals in Nepal experiencing high levels of autoclave failure. Current solutions for measuring temperature and pressure inside of autoclaves and verifying that they can sterilize their contents adequately are expensive and not reusable. We set out to design, prototype, and test a handheld autoclave parameter tester. We built one controlled by an Arduino microcontroller in a handheld plastic casing with temperature and pressure sensors. It takes in temperature and pressure data from its environment and compares it to known threshold values. And we tested it such that it can meet the minimum autoclave requirements of 30 psi and 121 degrees Celsius. Lastly, I want to spend a little minute and talk about my team and my chapter at the University of Minnesota as a whole. I'm so proud of the fact that when I started here in Design Comp my freshman year at the University of Minnesota, we had a team of 6, mostly biomedical engineering majors. That's now expanded to 2 design competition teams across engineering degrees and even beyond, with up to 20 people. I'm so proud of how far this team and this chapter have come, and I'm honored to accept this third place design competition award. Thank you.
All right, that was the thank you, University of Minnesota chapter members. For our second place winners of our 2023 design competition, we are excited to congratulate the University of Texas at Austin for their design, Thermo Revive, low-cost neonatal incubator, empowering low and middle income countries through repurposed hardware. Please join me in welcoming Shreya Chimalamari, who will accept this award on their behalf.
Thank you so much. Hello, I am Shreya Chimalamari, and I'm a member of the University of Texas at Austin EWH chapter, and our project is Thermo Revive, a low-cost neonatal incubator empowering low and middle-income countries through repurposed hardware. We are so honored to have placed in the EWH competition and be recognized for our year-long effort to improve neonatal care in underdeveloped and developing nations. As we move forward, we are excited to leverage this recognition to attract more opportunities and make a difference in the lives of some of the most vulnerable infants. On behalf of my team, I would like to sincerely thank the neonatal transport team at St. David's Medical Center, International Biomedical, Texas Invention Works, Dr. Stephen Abrams from Dell Medical School, and Dr. Tyrone Porter from UT Austin for their continued support and mentorship throughout our project. Lastly, I would want to thank Engineering World Health for hosting this competition and taking a leap forward to improve global health by empowering engineers all throughout the world. Thank you so much.
College Dublin with their project Pneumo Detect, an efficient point-of-use device for early detection and monitoring of pneumonia in infants in developing countries. I am happy to introduce Sarthak Jain on behalf of the UCD chapter.
Hi, thanks. Hi, Sarthak and my teammates Beryl and Nathan are deeply humbled and would like to express our utmost gratitude for this recognition. First and foremost, I would like to thank esteemed panel of judges for recognizing the potential of our project. Your expertise and judgment inspire all of us to aim higher and push the boundaries of what is possible. Our design, basically born out of passion of improving the infant mortality rate, helped us embark on a journey of early diagnosis of childhood pneumonia, especially for children below 5 years of age. According to UNESCO, a child dies every 43 seconds due to pneumonia globally. Our project is a unique, one-of-a-kind device to measure early biomarkers present in the breath of the patient non-invasively with the help of a cheap chemical sensor, and normally which is not possible up till now. The ultimate goal of our project is to make a meaningful impact on people's life, particularly those underserved communities, by providing access to healthcare solutions that were not considered out of reach up till now. This award not only validates our dedication and hard work, but also fuels our commitment to continue striving for excellence in the field of biomedical engineering. Thank you.
Thank you, University College Dublin. And thank you and congratulations to all of our winners and all of our participants for another successful year. So now please allow me to pass things back over to the EWH President and CEO, Chujan Rahal.
Hello. Well, thank you so much, Janaea. Congratulations to all the design competition winners. If you aren't a part of a chapter, please do contact us and speak with Janaea to start your own student chapter. We're always looking for expanding our reach across the world. As you've seen from everyone's firsthand experiences, it's truly impactful. And I myself was an EWH chapter member in undergrad. So you never know where the world takes you. With that, one project that we're passionate about is also engineering education. So that K through 12 STEM pathway, and not just the university programs. And so that is what started our Kits for the Classroom program. And so we've always had our kits that are related to, heart rate monitoring and ECGs and so forth. But what we did is we took it a step further and made them more plug and play style. So during COVID, teachers could order them, we could ship them to the students' homes and they can do them virtually with their teacher because they didn't require soldering iron or anything really too complex. They could just plug and play like Legos and then use it to do various testings. We also included with it, a whole package of like gummy bears and lasers and like how does the light shine through and how does that relate to the blood and measuring oxygen levels and so forth. So we made it very engaging. Now, Kits for the Classroom specifically, those kits are donated to classrooms via sponsorship. So we have various sponsors that fund donating these kits to schools, specifically Title I schools. So Title I schools are schools where the majority of students in the US are from either low-income backgrounds or underserved areas that really don't have STEM programming or access to much resources. And so we are able to provide these to those schools so that we can enhance their STEM exposure. Because we all know, younger kids will make up their mind whether they love or hate STEM very early. And so we want to engage them as soon as we can. But yes, we're very proud that this past year, we've, given out almost 400 kits. We've touched, the lives of over, 1,000 students, 14 schools. They're reusable, so it's not wasteful. So they can use them in one class, use them in the next class, use them in the following year. So teachers are loving that aspect. And what can I say? We're very excited about it and all the other work we've been doing. So with that, I want to introduce you to Rachel, who is our Director of Communication and Marketing, and she has a very special speaker lined up for you.
Hi, everybody. Thank you so much for joining us today. Just to echo what everyone else has said. Yes, my name is Rachel Goforth. I am the Manager of Development and Communications for EWH, and it is my absolute pleasure to introduce you to our keynote speaker, Deanna Hood. Deanna is a senior robotics and software engineer, passionate about using tech for good and inspiring others to do the same. She has spent the last 13 years bringing creativity and innovation to engineering's most exciting applications, including as a core software engineer on ROS-2, now used in NASA's Viper mission, designing an innovative robotic partner for children with handwriting difficulties, using firmware and electronics to support cancer researchers, and developing a low-cost USB stethoscope for diagnosing pneumonia in children in Mozambique. Most recently, she worked on the LEGO skin printing robot, an early-stage medical device in partnership with renowned burn surgeon, Professor Fiona Wood. In 2022, she was named Australian Young Engineer of the Year, but before all that, Deanna participated in EWH's 2015 Summer Institute in Nicaragua. Deanna, thank you so much for joining us today. We're so happy to have you.
Oh my gosh, thanks for the introduction. Saves me some time because I don't like to speak about myself too much, but I'll just check that you can see something of my slides right now, right? Well, thank you for having me. I've been just beaming the whole session so far to be reminded of how amazing the impact of EWH is. And you heard that I'm the current Young Engineer of the Year in Australia, and that's because of the impact that I have chosen to make in my career. And then along the side, the impact that I like to have through inspiring other people to maybe join me in the challenge of using technology to help people. So in the last year, I've spoken to 2,000 students in person because I enjoy inspiring people, encouraging and supporting people who want to be engineers, because if you haven't noticed, like having an impact on specific individuals like this is a lot of fun. So that's kind of what I'm actually here today for. I can definitely just talk about myself, but Rachel's kind of done enough. I want to talk about you, and by you, I mean anyone who would like to maybe do more, whatever that means to you. So the session's for you, but I did learn from students that they do like to see some pictures of the things that I have done. I'll just quickly talk about like some of the what that I've done, and then we'll go back to like how is it possible and how can you maybe take some life hacks from me. So I'm an electrical engineer. I have a master's in robotics and I kind of work on the software side of things now. And I'm not a biomedical engineer, but I'll show you some pictures of what Rachel described. So this is a brain control car, top left, with applications for people with paralysis. I did the electronics and the software control systems. With the right robots, that's the Lego skin printing robot for burns patients. And top right is the Rastrum 3D bioprinter used by cancer researchers. And a team of engineers from all different types. You heard Juko say that everyone has a different role to play in these engineering products. The bottom left is a medical robot that I'm working on now, which is an artery scanning robot for vascular surgeons to help dialysis patients. And an educational robot there that children actually teach, and a low-cost stethoscope for diagnosing pneumonia in Mozambique. Like you heard, this is the second time, I never thought I'd be in a presentation where this technology was mentioned twice. And so this is like, these projects span all different fields in terms of like impact in society that I've written on the left. But I just want to emphasize that I do it my way. I have a lot of respect for doctors, teachers, occupational therapists, biomedical engineers, but it's not my personal interest. So if it's not yours either, I just want to remind you that there's a role for everyone in these impactful projects. So, okay, I'm assuming that I'm already talking to people who know, you're here, you know that engineers can help people. And there are lots of things sometimes that we know theoretically, but then it's like, okay, but when it comes to implementation, how do I do it? How do I bring myself to go and do amazing things? And I think courage comes into it, but even courage is like, how do I courage? And so I've been thinking about this a lot lately because I told you I've been speaking to lots of students and I collect feedback from my talks that made me realize that one of the big things that students are asking is like, how do I have motivation, courage, like just how? So I've been thinking like, trying to understand myself. What is it that makes me do things that other people consider brave when I actually don't consider myself to be a particularly brave person? And I have some life hacks that I want to share with you. But first, just to set some like context, I think after my like reflections, I think that courage, persistence comes, what it represents is like persistence, doing hard things, but that only comes when hard things are perceived as being worthwhile. And so that let me say. So mathematically, like I'm also a trained mathematician. I think of it like this, that persistence to me happens when your motivation for something outweighs the challenges that you come up against. And if persistence is like when hard things feel worthwhile, you have two choices. You can make a hard thing less hard by like reducing some of the challenges, getting support, getting scholarships if it's a financial challenge, or increasing the motivation. So make a hard thing more worthwhile by changing either side of this like mathematical expression. And I want to give you examples from my experience at the EWH Summer Institute, which I did in Nicaragua, for ways you can make this expression more complex than you'd otherwise think. Because if you think about it too simply, then you get turned off. Most people would see, okay, I will go to the EWH Institute if my desire to help people outweighs my fear of going. And like, I don't even know if that was true for me. Like, I don't know how I got there, but this is like, it's true that desire to help is a motivation. Like, with my teammate, we put 40 pieces of equipment back into service. Like, impact is there, we helped people. But fear of going, also very true. So I'm a bit used to it now, but I definitely was scared to sign up for this. So how did I end up with this like courage to go forward? And it's because now I see it more clearly that it's like the more of these experiences that you have, the more you realize that the equation here is oversimplified. It's actually more complex than this. And I want to show you all of the things that now I know whenever I consider trade-offs for going to Summer Institute or just to an event that EWH is putting on like at a local chapter. I'll show you how you can like hack courage in your favor. So life hacks for courage. I started a TikTok for students, and so this is my like TikTok talk. So 3 things to increase the motivation side of that expression. The first one is to recognize that like, yeah, you're going to help people, but also you will make connections that help yourself. And so I had this titled as like friends at some point, but I didn't want, these are friends from my EWH experience, but I didn't want you to think that like friends, I mean, oh, like a play group or something. Like we had a good time together. The 2 pictures are on the left, and like karaoke in Spanish is just as fun. But the 3 on the right, they're outside of Nicaragua. We have stayed in touch, and we're more than just friends. Like friends as adults represents support and networks and connections. Like I'm at Sam's, on the right, that's me at Sam's wedding a couple of weeks ago. And Sindora, I met her in France, like long time ago, we're giving like mentorship about our masters. And then Zach, bottom right, you might recognize that bio printer from my introduction slide, that Zach artist that I went to EWH Summer Institute with, and a Raspberry bio printer, because we ended up working together through this connection. And he and I, like, we're the founding engineers on the Lego skin printing robot, indirectly because we met at this event. So I just want to say for maybe shy people or who are like, oh, that's great that you can make friends / connections, Deanna. But I want to point out that when you go to an event that is like a special interest group, say there are 20 people in the room or in the experience, these aren't like 20 random people. Your odds of like hitting it off with 20 random people from society, I admit like they're not that high. But if you've done conditional probability, like this is a special set of people, and the probability of connecting with people conditional on the fact that you have signed up for the same project and the same experience is actually, the odds are in your favor for that. So connections literally changed my life. The other is like personal growth. And this is a specific type of personal growth that comes from being alone, like being the only person in the room to solve your problems. So when I was in Nicaragua, Sindora and I, there was no one else to help us with Spanish. We grew a lot, I can tell you, because people are wondering like, how I can learn languages, but being forced in the middle of nowhere is the ideal way to learn a language, and it's the ideal place for all sorts of personal growth. So I put some pictures of my travels there because I think independent travel is one of the things that you also learn through the EWH Summer Institute that's like in your interest. Because to do it in this kind of structured environment at first is how you learn to travel. And now, like, I'm an expert traveler, independent traveler. I've been to like 47 countries because I like feeling like Superwoman when I'm alone in the middle of nowhere and I depend on myself. So that personal growth, being the only person in the room, extends also to the fact that you're there to fix equipment that probably you don't feel qualified to fix. Like, I did not feel qualified to fix the equipment. I just want to point out, I didn't know Spanish when I went, and I did not know anything about medical equipment. But when you are the only person there who's willing to help, it doesn't matter if you're the most qualified. You are the most qualified by proxy of being the closest person who's willing to do something. So that really worked in my favor, because the third like impact on my life from the Summer Institute was that I really love taking things apart, and I was too scared to do it before. Too scared until I was in the middle of nowhere, and it's like, well, if no one else is going to do it, then let me open up this oven and find out that it's got actually a thermostat that's a vial of mercury that physically tips back and forth, and you can see the spark as it closes the control circuit. Like, these were some of the best days of my life, not because I was helping people, but because it's really amazing to see what is inside of old equipment. And I would absolutely do this again, and I do it myself now just for fun. Like, this is a dress dolly on the right that I picked up for free. Someone was getting rid of it because it was damaged, and it's vintage, and I repaired it and I sold it. It's like, this stuff is fun, but we keep ourselves from experiencing them when we're in the normal world of like, oh, other people are more qualified. So being in those constrained settings means that you can have all of these experiences, but you need to use these like life hacks to flip from this simplified version of like, my fear of going is outweighing my desire to help people. This is where the result is that you stay on the couch for this. But if you incorporate a realization that you can be motivated like selfishly for these things too, you will grow through the connections that you'll make. You'll grow through like the personal growth that you experience from this, and you'll grow just by learning new things. And so this way of thinking can be applied to get you off the couch for even very small things that you feel like, gee, I wish I were more motivated to do that. If you're afraid to go to an event and meet people, then remember to factor in these things of like, maybe I'll learn something at the event. Maybe I will grow as a person just a little bit, and maybe I'll meet someone that in the end ends up changing my life, perhaps. So these are my reflections on how it is that a non-brave person has ended up doing a career of what people consider to be very courageous things, while being afraid the whole time. And I have plenty more things to say, but you'll have to reach out to me perhaps in a different context, and I'd be very happy to continue the conversation.
Thank you so much, Deanna. It is always a pleasure to hear from you. Yes, thank you. And now I will pass it back over to Tujan, who has a very exciting announcement for us all. And I will mention the links to everything that we've talked about today will be in the chat. So yes, Tujan, go ahead and take it away.
Awesome. Well, that was wonderful. What a packed session with some great speakers and updates. Thank you also to our staff, who without them, this could not have happened. So shout out to the entire team. And of course, our supporters from near and far. So I want to conclude today with a very exciting announcement. And I don't know if Rachel wants to share our screen, but you're the first to know that as of today, EWH is officially and finally launching a membership program. So what this means is, just like other professional engineering groups like Society of Women Engineers, NSBE, Society of Hispanic Professional Engineers, you can now become an EWH member. What this means is that we're going to engage the entire global community more. We'll have professional affiliation options on the individual level. Our members can network together like really never before. And we'll continue to develop this program, but what will happen in the meantime is the EWH members will have access to our special events, our discounts, as well as special consideration tier opportunities and some of our traveling opportunities. And of course, your membership is going to support EWH and the work we're doing to improve healthcare delivery around the world. You can see here the different levels. We're very excited to have this affiliation even for high schoolers, and that is free. We want them to join, get engaged, so when they go to the university, they'll be able to start their own university chapter. And that's a university chapter, the chapters have their own membership process. And then, of course, our young professionals, who are many are alumni, can join us, as well as professionals. And if you want to be a lifetime supporter, we have that option as well. And with that, I want to say there's obviously many other ways to also support EWH. I really encourage you to sign up for our bi-monthly newsletter. You can, of course, attend our institutes. We have donor trips that happen that you can join, or interest trips. You can follow us on social media. Our social media is loaded with personal stories. Though in the summer, we had takeovers by some of our students that were on the ground, and it was so fun to watch. You can follow Instagram, LinkedIn, Twitter, we're everywhere. And then, of course, if you are an alumni or a professional and you want to engage more, we have our Industry and Alumni Council that you're welcome to get in touch with us about to join. And with that, our final thank you goes out to all of our donors and partners and supporters, including yourselves, whom without we could not do this and we could not get this far with the impact we're having across the world. We're very grateful, and I'm very thankful that everybody has joined us today. And I hope to see you again sooner than next year, but at the very least next year when we do this again and give you more updates. And that concludes Engage 2023.